Hello?
Hi.
Hello,
Hi,
this
Doctor.
is Dennis Peters.
Yes, hi,
Hello.
Doctor. Hello.
Afternoon to you. Hello,
Thank you for seeing me.
I am Dr. Madaliev. My pleasure, I am Dr. Madaliev.
Hi.
How can I help you today?
Well, you tell me, Doctor.
Oh,
I've been
yeah.
asked to see you.
Okay,
I don't know. I had a blood test and I've been told it's wrong.
right,
I'm
okay.
not sure what's wrong with them, so you carry on, Doctor. You
Okay.
later on.
Fine, yeah. I can see you have had a blood test recently. That's what we're going to probably discuss today, isn't it? Yeah. Would you like me to go through your blood results, or shall I? I mean,
yes, please, because I don't know what's wrong with them.
Okay.
The receptionist couldn't tell me what's
Okay.
wrong with them. I
Yeah.
asked them several times,
Yeah.
so I'm just explaining.
No, that's fine. The options are we could go through them straight away, or we could have a chat a bit more, because sometimes we need to talk about things first before we can read the blood, these
yeah,
blood
if you could
results.
tell me blood results,
Fine.
Doctor.
Okay.
Appreciate that.
Okay. Your blood results actually come back saying one of those results actually show that your sugar levels are on the high side.
Okay.
So is that something new?
Of course, I wasn't expecting that. So does that mean am I eating too much sugar?
Well, not necessarily. Maybe that means probably explain that your sugar levels are being in your blood has been high consistently over the last kind of 3 months at least or so. It could be because of the diet, could be obviously, or because of this. As we get older, some of the parts of our body doesn't function or doesn't break down the sugars as well as they should do, and that's caused that the sugar level stays in the blood a bit high for some period of time.
Okay.
Okay, and the name is for it's called diabetes.
Oh,
It's
yeah,
type 2 diabetes. Have you
I
heard
know
of that?
I know that.
Okay.
Ooh, that's not good, is it?
Does it come as a surprise to you?
Yeah, I didn't expect that, to be
No.
honest.
Okay.
No. Yeah, and my uncle had diabetes.
Yeah. And how does it make you feel now, knowing that you have sort of possibly diabetes?
I'm starting to worry, actually.
Yeah. What's worrying you?
Well, as I said, my uncle had diabetes, and I saw him struggling with it, and he had his leg chopped off
Okay.
because of that.
Right. That's scary, isn't it? I guess.
Of course, yeah.
Yeah. Okay. Well, I think the good news is that we know it now that you have diabetes, and there's a lot of things can be done to help with that. Okay. So before I go to discuss with you options of kind of treatment for diabetes or management of the diabetes, what you can do and what we can do and so on, can I have a chat about yourself a bit more? So, because in context that we can put what I can help you with and what you can do, change around and so on as well.
Yeah.
So it will be some thought process.
Yeah, sounds
So
good.
my note says you got blood pressure problems, haven't you?
I have,
Yeah.
I have high blood
And I
pressure.
can see your rest of the bloods are fine. You have a kidney function is actually not so bad, and I think I would say it's appropriate to your age.
Okay,
Okay.
good.
Fine. And your cholesterol levels are within a sort of normal range as well. I sort of would say that this is really high. So, you're taking your medication regularly otherwise?
Yeah.
Yeah.
Mhm.
My note says you live on your own, is that right?
Yeah,
Yeah.
I do. Yeah,
Okay.
my wife died 3 years ago
Oh, I'm
from
sorry to
breast
hear.
cancer.
Okay.
Yeah.
Okay. And how are you coping at home?
Fine, I got used to it now. Yeah, I have 2 daughters.
Okay.
They do their own things. They live separately now.
Grandchildren as well?
No, not yet.
Okay, fine. And you see your daughters regularly?
Yeah, they look after me
Okay,
quite well.
Good. What do you do for a living?
Nothing now.
You still work or you're retired now?
I'm
Okay.
retired now.
Fine, okay. And how things at home otherwise, obviously. Are you keeping yourself busy? Do you do anything
Yeah,
specific?
I'm always busy.
Yeah.
I see my friends. I'm around all the time.
Yeah.
I with my daughters,
Okay.
so I have plenty to do.
Good.
Quite
Yeah.
busy.
How are you feeling yourself otherwise in general?
Fine, doctor.
Yeah. Okay. Good. Any concerns in terms of regarding your health? No? Okay, good. And some people, when they have diabetes, they tend to develop some symptoms like excessive thirst, or they start passing a lot of urine or any of that. Have you had any of that at all?
Yeah, as you mentioned that, actually, maybe, because I do go to toilet during the night a couple of times at least.
Okay.
And I always drink after that because I'm always thirsty.
Okay.
Yeah.
All right. Okay. And
I
you said
never thought it can affect my health, or I never felt felt unwell with it.
Yeah, of course. Okay, fine. And in terms of otherwise, any other problems, any chest problems, any tummy problems, anything like that at all? Okay. Any recent weight loss?
No.
Any night sweats or anything like that at all? Okay, good. And how's your diet like?
Well, I tried with balanced diet, but since my wife died, I think everything got pear-shaped. So I eat just whatever I can. Well, I'm not that meticulous with my cooking. But I think I ate all right.
Do you think so? Okay, fine. And in terms of your exercise, how much do you think you exercise?
I don't do regular exercises, but as now I'm thinking maybe it would be better to get a dog and walk a dog.
Yeah, that's something maybe quite good, something maybe help with the diabetes as well, I guess. Okay, let's have a chat now about diabetes. What do you know about it?
It's well, sugar is high. I heard it's in the blood. That's all I know actually.
Okay. Would you like me to explain to you?
Would be lovely.
Yeah, I did mention briefly earlier that diabetes, obviously, yes, sugar. You're absolutely right. Sugar being high in the blood is just because they used to, when we eat certain things, our body break down the sugar very fast. And as we get older, sometimes, especially if they have family history of blood pressure, diabetes, and so on, or if you have a bit of a tendency yourself, then obviously we do have that struggle. Our body struggles to break down that sugar as fast as they used to, and sugar levels are still high. And when they're so high, they obviously cause some certain problems, and cause a problem with the eye. So because of the clog up the small blood vessels, sometimes can cause a problem with the kidneys.
Okay.
And they, yeah.
No, I wouldn't want that problems happen to me.
No. And obviously that obviously increases the risk of heart attacks and strokes as well, because their blood is so thick as well. Okay. I think that it's quite important we get on the top of that blood pressure, your sugar problem. Okay, there's a certain things you can do to help yourself. Actually, you can manage that quite well. There's a lot of things can be done. Obviously, the diet, making sure you eat less sugar, or the food which is release the sugar very slowly throughout the day. That's quite important bit. And obviously, the exercise is quite important bit. And there's a certain medications we can help with that as well if it's needed to. Okay. So the options are, we could probably kind of, if you're worried about how you can manage your diet and so on, there's options of actually having dietitians help. That would be option we could refer to. And that option, obviously, we could have referred to the group of called Healthy Living, or the Dorset Live Well Association to help you with the exercises and so on.
So lots of options.
Yeah, there's option of, obviously, we could give you some letters actually to join the gym and so on the discounted prices and so on as well.
Okay. Yeah, that sounds good actually. Yeah. And as I mentioned, maybe I can get the dog.
Absolutely, so I was just about to say, you mentioned about the dog. That was such a lovely idea. Maybe that's something makes you kind of go out for a walk with Doctor.
Yeah. That's a good idea.
Yeah. How do you feel all this about this?
Yeah, it seems too much. But I can get the dog. And regarding diet, I'm not entirely sure, but you suggesting dietitian, maybe they can give me some list of products or foods which I can eat. Yeah. That's good. Yeah. Anything else I can do?
I think we discussed about what you could do in terms of exercise and diet and so on, and the referrals and so on. The other things we could do, we could print out some information about diabetes, because I've kind of dropped all this now. Sort of, you may have a bit more, the questions to ask, and you want to know more about it. I would be quite happy to see you in a couple of weeks' time, see how you're getting on with your exercise and so on. And then we'll have a chat a bit more if I give you some information about diabetes. And there's a special groups, and we could book you in with a nurse, diabetic nurse in a surgery as well. She's very good with the things, so she will have to kind of make sure you get an appointment to check your eye, check your legs and so on as well. And the other thing, sort of make sure we check your blood pressure regularly, because we need to control your blood pressure very well when you have diabetes. It's quite important.
Yeah.
Is that all right?
That sounds good.
Yeah. Shall we meet up next in a couple of weeks' time, see how you're getting on?
Yeah, would be perfect.
Okay, so we agreed certain things, what you could do.
And I don't need to take any medication now.
Well, I think there's options of taking medication as well. There's a medication called metformin we may need to start normally when the people are over 48. Okay. But obviously that is, again, we need to discuss that in more details. We could have a chat about next week.
Okay.
Is that
That's
all right?
fine. Yeah.
Yeah.
Mm-hmm.
Thank
You can
you.
do that. Thank you.